Welcome, everybody. Welcome to episode 24 of Practical Psychology Podcast. My name is Joseph Wong. I'm one of the co hosts. Today, we are very happy to have Lindy Fors. Lindy is a certified Canadian counselor based in Stave Lake in northern Alberta here. Lindy specializes in neurodivergence, counseling, and assessments for both adult, children, and teenagers here. I very welcome you, Lindy.
Thank you. Good to be here.
So Lindy here, one of the first thing a lot of viewers want to ask you is, tell us a little bit about assessment and your general experience working with neurodivergence population.
Well, I've been working with neurodivergent populations for over 20 years now, and it started with working in the support worker area with adults with disabilities. And then I moved into working with autistic children and with multidisciplinary teams. And then I moved into teaching, and I have a master's in education. So I do assessment, level B assessments and screeners from that perspective. And then as I moved into counseling, became more of a around the psych ed um, piece and doing report writing. And with my current focus for today with the ADOS, the autism assessment, I do virtual adult autism assessments.
Wow, Lindy, tell us a little bit about working with neurodivergence population compared to neurotypical population. What are the differences here?
Well, the differences are really interesting because there's a lot of stereotypes and stigma, and there's a lot of variability. So somebody might present as very high functioning, they're masking their traits very effectively. And then there's some people who present quite atypically that you would think of for autism. So that is one of the interesting pieces, is that it isn't a one size fits all. And especially when we're talking about adults, we have a lot of other variables. So there can be concurrent disorders, so disorders that are happening at the same time, as well as mental health issues, things like anxiety, depression, because there's a lot of internalization of being atypical.
Yeah.
And it's not that this is what I often say to clients, it's not that you think wrong or the way that you approach situations or how you process things are wrong, which is often what neurodivergent individuals are told throughout the years. And they're asked to behave differently and to mask some of those atypical, traits. They have a lot of other things going on for adults who have learned how to learned other strategies. They've learned how to mask. They've learned how to camouflage. They learn how to fit in, and as a result, there's a lot of internalized issues that they process as they start to go through the diagnosis and the assessment.
Wow, so Lindy, in a way here, there's a lot to talk about neurodivergence and also a lot of co-occurring symptoms, even circumstantial challenges.
Mm-hmm. Yeah, that's true. And I think the big thing to remember is that neurodivergence isn't a mental health issue. It is a mental illness, and it's something that somebody is born with. So part of the process with assessment and eventually diagnosis is there's a lot of pieces that are looked at, very much for the reason that, there's other disorders that can present as autistic characteristics. There's other disorders that can present as ADHD characteristics, for instance. So when we're looking at neurodivergence, we're looking way back into childhood to see where
Yeah.
those characteristics were first noticed, if possible. Sometimes I'm working with adults who are in their 50s or 60s, and going back that far,
Mm.
whether it's memory or having people who were there at the time makes it difficult. So it really becomes an investigation into a lifelong process and a lifelong journey.
Wow. So Lindy, let's walk back a little bit here for our viewers here first. When we listen to this term neurodivergence, because people can go to TikTok, social media, Instagram, Facebook to hear about all these. Clinically, what does neurodivergence mean?
Neurodivergence just means processing differently, to put it really simply. So a brain is
Okay.
neurodivergent brain is just wired differently, and it's just the way it is for someone who has a neurodivergent brain as opposed to a neurotypical brain. So neurotypical is considered that average, typical way of processing information, social interactions. So we're looking at those average, um, mainstream abilities. And then when you're looking at a neurodivergent brain, we've got some divergent ways of thinking, processing, relating to situations. There may be sensory issues that the way the brain processes different taste, sounds, smells, things like that. When I worked with autistic preschoolers, one of the things that was noticed by the rest of her classmates when we were trying to integrate her into the classroom was the sounds. So I would notice when the furnace clicked on in the middle of the
Okay.
school, and I would shut the door because I knew that that would trigger a behavior for her. But the other kids didn't hear it. And what was really cool about that is when she wasn't in the room, the kid said, "Why do you get up and shut the door?" And I said, "It's because she has like a superpower. She has super hearing. So she's hearing things that you don't hear, and it starts to bother her. And that's why sometimes she might act a little bit differently if there's sounds that are really bothering her." And what was really nice about that is the parents came back the next day and they said, our kids are saying that she's like Superman. She has superpowers. And if there's no
Mm.
other message that comes out of this visit together or the work that I do, is that it's a superpower, it's strengths, and it's a matter of getting to that place of acceptance that this is my normal when you have a neurodivergent brain.
Oh, yeah, that's a great example of a child here. How about neurodivergence? What does it mean for an adult setting?
In adults, like I said, there's a lot of internalization and there's a lot of what we call
Okay.
masking and camouflaging. So camouflaging is
Mm,
almost like taking on a script or another persona in order to
mm,
hide how you're truly feeling inside or how you're truly processing where some of those struggles and challenges are. Social situations are very difficult. Um,
mm,
just some, and when we work with children and youth, we do social stories in order to teach them, how do I say goodbye? How do I end a conversation? How do I make friends? How do I keep friends? And with adults,
mm.
because they've already gone through that journey, and in all these cases where they haven't had any diagnosis, they've just been learning how to interact in a typical way while hiding what they're really feeling and thinking inside. And that's where things like anxiety and depression can arise.
Oh, yeah, because when you talk about masking, it looks like it means they have to put on a different persona, a different
Mm-hmm.
personality. So they have to manage two sets of personality. Very, very difficult.
Mm-hmm. So part of the process with counseling is finding that true identity and that true
Mm,
self, acceptance, and then accepting that this is my normal and that I'm okay. It's just that I
mm,
process things differently or I see the world through a different filter. And one example that I use is, a sports team. So you really want to join the running team, and they're all running the 100-yard dash and they're going straight down the lane, and you want to be a part of it so badly, but when you try and run, you run sideways, and there's
okay,
no
yeah.
matter how hard you try and run straight down that lane, you're not able to do that. And so part of the identity process and the healing comes through recognizing that I may not run down the lane, but running sideways has its benefits. And then some
Okay.
strategies, of course, to cope and to integrate within our regular society and work situations in a way that works for that individual.
Okay, I see. Okay. So, Lindy here, under this umbrella term of neurodivergence, what are the categories or symptoms or diagnosis usually fit under this neurodivergence term?
So when we're looking specifically at autism, we're looking at difficulties in the area of communication, things like
Okay.
reciprocal social interaction, repetitive behaviors, maybe interests. So a really perseverating, we say that kind of only having specific interests. So that's part of that psychoeducation that happens to say when you are having conversations with people, how do I talk to them about their interests? What kind of questions should I ask? Because it doesn't make sense from an autistic point of view to talk about other things. This is what I'm interested in, and this is all I'm going to talk about. And then when I'm done, I'm done. And so the process that I try and take the clients on a journey with is not only that acceptance, but also, how do I find those ways to be more neurotypical in how I interact with people?
Wow, so Lindy, the autism is under this neurodivergence umbrella, and what other diagnoses or conditions are under neurodivergence?
Well, ADHD is one. And so when we're
Okay.
looking at, especially for assessment, is looking at the fact that sometimes autism will be misdiagnosed or ADHD will be diagnosed instead of autism. So I'm really careful when we go through the process, not only with interviews, but also looking at comparatively, is it coming from an anxiety diagnosis, or is it coming from an ADHD diagnosis, or is it really autism? The other thing that can present
Okay.
as autistic traits is trauma, for instance. So it's
Okay.
really important to pull those pieces apart and to really be methodical when it comes to looking at assessment and how those conclusions are derived.
Wow, so under the neurodivergence umbrella here, we have autism, ADHD, and also some potential trauma, which is under disguise under this neurodivergence.
Well, I think trauma isn't so much as neurodivergent as it
Okay, yeah.
can
Mm,
replicate, an
yeah.
atypical processing or a
Okay.
neurodivergent um, executive functioning skills. The gaps that it
Mm-hmm.
can and the impacts that it can have on the brain can happen later in life. So it's neurodivergence. Really, the best way to look at it is you're born with it and it doesn't develop later.
Okay,
So
I
that's one of the
see.
key differences, and
Oh,
that's why we
yeah.
do a lot of questions and interview questions around childhood. So maybe parents,
Oh.
if they're still around for the adults, maybe anecdotal information from siblings, if there's any school friends that we can talk to that we
Okay.
take that information from and see that it truly is something that had developed from childhood. So it's usually diagnosed or presents within the first couple of years of life.
Oh, yeah, thank you, Lindy, because this clear up a lot of misconceptions that
Mhm.
neurodivergent is starting from birth, not something that is developed later, based on
That's
other things like
correct.
trauma. Okay, yeah.
Yeah.
So, Lindy, I have a questions.
hmm
And a lot of viewers ask, what exactly is this term spectrum? What does it mean? What exactly it is?
That's an excellent question. That's why it's so difficult to understand, an autism diagnosis, for instance, because it's so variable. Like you have severe, moderate, and mild. So
Mm,
we have three levels. And in the
mm,
severe level, that's where your typical, maybe stereotypical autistic individual is, where there's nonverbal, there's a lot of sensory issues, there's a lot of very limited social interactions, there's high levels of sensitivity to sensory processing. And then you have the mild, which is not so much a diagnosis
mm,
anymore, but things like high functioning autism, where there's a lot of
okay.
traits that have that diagnostic impression, but the individual is very high functioning, verbal. There's no cognitive or intellectual disabilities, and they're able to navigate their world, to different degrees.
Oh, so in a way that Linda, you mentioned about this level 1, 2, and 3 in the spectrum of autism. I guess how we watch in movies is what the level 3 looks like when they portrayed it in the popular culture. People who are
Mm-hmm.
nonverbal have a lot of symptoms.
Mm-hmm. Yeah, and I think that's where stereotypes and stigma arises. Like I think really understanding um a person as an individual and as a human being who brings the same emotions, the same need for validation, the same need for interaction with other people, but in a different way. So working in classrooms, for instance, I'll often see behaviors result from not connecting with fellow students. So there might be attempts, but they're awkward or they're aggressive or they're maybe at a different developmental level. When we look at adults, that interaction is sometimes awkward. There's often also a lot of processing that's happened over the years when it comes to bullying because they might be called weird or um, they might be bullied throughout at work or dismissed or not be able to get a job or keep a job because that social interaction piece is really awkward.
Oh yeah, yeah. This misunderstanding about psychology and mental health and neurodivergence cause a lot of unnecessary problems. Yeah. Oh,
Well, it's
Linda, I have a question here.
true. Yeah. Thank you.
So, in Alberta right now, because you're in Alberta, and are there any government funding for level 3, 2, 1 neurodivergence or autism?
For you, there is funding available for kids and youth up to age 18 through the
Okay.
schools. There's multidisciplinary funding for allied health services. So things like occupational therapy, speech language
Okay.
therapy, physical therapy, all of those professions are tools in the programming for the children and provide additional supports at home. When a child hits 18, their funding stops and then they move into a different area called PDD, which is the disabilities um, uh, the disabilities funding through the government. And oftentimes, if it's a severe diagnosis, then they may go on AISH, and funding does become a lot more limited. So we really rely on catching it early, making sure that those diagnoses and that support is happening for the child in the school, because then they can integrate and they can become more independent and functioning within the greater society once they're out of school. And we have lots of individuals who have autism who've gone through post-secondary and are very successful in their careers. So that's the difficult way. It's difficult to um, generalize because of that spectrum. You have you have a variety of presentations, so to speak.
Oh. And Lindy here for atypical parents, if they notice their young child is having some neurodivergent behavior, and where do they seek help to get that diagnosis and then eventually to get the destinations and funding?
Well, normally a parent is seeing that at an early age, and it's very difficult to get assessments, to be honest, in our province. And from what I understand from other provinces, there's usually a 1 to 2 year wait unless parents can go through a private clinic. Um, that's why some of these tools aren't necessarily a formal diagnosis, but the ADOS can give the parents an insight into some of the different aspects that they're seeing in their student in their child, and
Oh,
have that confirmed or not confirmed, whether they're on that autism spectrum or not. But it is quite a big process and it can be very expensive for parents. For adults, it's much easier. For instance, I do the virtual ADOS assessment. We do a 2 hour assessment. We do intake interview and then a follow up with a report. And then if there's a formal diagnosis needed for work or school, then I work with a psychologist to get that final piece done where we analyze all the information and come up with a formal diagnosis for them.
Wow. So Lindy, for adult, it's easier than children to get an
Mm-hmm.
assessment.
Mm-hmm. It's difficult because most of the times parents are going through the school and assessments very, like I said, it's limited availability often.
Mm,
It's expensive and there are long wait lists. And when you're looking at autism or neurodivergent kids,
mm,
you've got to have medical professionals, you have to have a psychologist, you have
mm,
to have these various interviews, clinical interviews. And the ADOS, the
mm.
Autism Diagnostic Observation Schedule, is just one piece of that.
Oh, wow. So for children, the ADOS is just one piece. What are the other pieces that is needed?
What would be a clinical interview? So parents, we'd get parents
Okay.
observations. Then the medical piece has to have a visual or like an eye exam and an audiologist or an audio
Wow.
audio exam. A speech and language pathologist usually can do that. Um,
Wow. Okay.
because you want to look at and this is the case with whether it's students at school, your child, or even as an adult. The best rule of thumb is parsimony. So look at the simplest reasons first. So if a child has poor vision, for instance, in a classroom, you might see more behaviors because they can't see the
Okay.
board. So
Okay.
glasses
Yeah.
can help. So
Okay.
it's
Yeah.
really just a matter of elimination and coordination between different professions to make sure that it is
Okay.
a formal diagnosis can be authentic and arrived at in a good way.
Well, so Linda, you were mentioning for a child, they have to look at the vision and then the audio, the speech. So multiple different doctors and subspecialties
Hmm. Hmm.
involved. There's a long process.
It is. Yeah, it is. And I think one of the things we forget,
Oh,
perhaps maybe as counselors or as educators, is that parents need a lot of support as well. So
yeah.
they're navigating a lot of not only, worry and concern for their child, but they're navigating a lot of their own internalization. So when you first get
Yeah.
that diagnosis, whether it's a parent or an adult, there's an initial shock almost. And for parents,
Okay.
sometimes there's a bit of guilt there. There's
Yeah.
a bit of consternation. Is it something I've done? And then there's that process of acceptance and coming to that point of view that a diagnosis and is actually a very good thing because then targeted resources, targeted psychoeducation, targeted strategies that fit that child or the adult can be implemented by the child's team at the school, for instance, or for an adult, they can then have a better
Yeah.
understanding of and those aha moments. This is why I feel the way I do. This is why I process things the way I do.
Also, Linda, just for the parent to kind of receive the diagnosis and make sense of it, and it is just a huge adjustment. Not to
Mm-hmm.
mention about the years of caregiver burnout and not knowing how to navigate the medical system in Alberta.
Exactly. Yeah.
So, Lindy, do you do any coaching about because the parents will have no clue about how to navigate this destination diagnosis process to begin with?
Oh, absolutely. So especially if I'm able to work and collaborate with the school team, that's ideal because then we can make sure that there's
Mm,
wraparound services and wraparound interventions. So what they're doing at the
mm,
school is also being reinforced at home and vice versa. And there's occasionally there's again stigma or misunderstanding about what's happening for a child in the school system and why are they behaving the way that they do or why are they able to comply with some of the expectations in a classroom and working with the school team and the parent. I think it's just really effective and it really provides that compassion and person-centered support that a child needs.
Oh, I see. Okay, yeah. So, Lindy, let's talk about the ADOS here. What is the full name for ADOS?
It's the Autism Diagnostic Observation Schedule, and it was first created in the 80s, and then it was updated in the early
Okay.
2000s, and it's one of the standardized tools used to evaluate some of these aspects that are typically connected to autistic traits.
Okay, because you are trained to do this autism diagnosis and assessment here. Can you walk me through about how long the appointment takes and how does it normally do it?
Well, I primarily do adult autism
Okay.
ADOS assessments,
Yeah.
and it can take anywhere from an hour to 2 hours. So I book 2 hours, and there's a variety of activities, little tasks that we go through, and it evaluates everything from conversation to a bit of an interview. We do some storytelling, describing emotions. I'm observing as well, so it's really important for the person to have a working video camera, and I can see their nonverbal behavior as well as taking into account what their answers are. And then we look at things like imagination and reciprocity. There's a thing with autism that's called, I want to say it right, uh, prosody. So it's the way communication it is, verbal communication is. So it might be, a flat affect, it might be disorganized
Okay.
rhythm, disorganized tone. There's repetition sometimes that happens with the conversation that you're having, and somebody might repeat back what you're saying, sort of like mimicking. So there's certain little cues and clues that happen during the assessment that are all taken into account, and then they're coded, and there's an algorithm that scores it for a
Mm.
final result.
After you do the 2 hours assessment, how long does it take for the individual to receive the results? What's the next step?
I work for a turnaround of 7 to 14 days.
Okay,
If I
yeah.
need to consult with a psychologist or get some extra information, then I'll follow up with the client. I always start with a screener or an intake call just to make sure that it's an appropriate tool for that person. We'll do a screener called the Autism Quotient questionnaire, and it gives us just an idea of where they're scoring, if it's consistent with autism
Mm,
or not. And that gives us a good foundation to start
mm,
from as well. I also sometimes give them a screener around camouflaging and masking so that it
okay.
identifies where they are on that scale as well.
Okay. So from the people that you assessed before, uh, who are the people who are turn out to be not suitable? So you say no need to do this ADOS.
Well, if there's a history of trauma, and then
Okay.
just if there's a concurrent diagnosis, so anxiety and ADHD, approaching that very carefully, and then
Okay.
primarily looking at when these characteristics first were noticed, or they were most prevalent. So if we're looking back to childhood, then and the characteristics aren't noticed or don't arise until youth, they're a teen,
Mm,
for instance, then that the chances are that that's not necessarily the most appropriate course of action at that time. So it's really important for me to be ethical and make sure that we're investigating all possible
yeah.
modalities to make sure that the client is getting the best assessment and best report from the information that I can gain from them.
Okay. And in the here, when the adult individual come to you for the ADOS to get the assessment here, what are usually some of the purpose of these assessment for work, school, or what are they for normally?
Occasionally, most of the time, it's for work. Um, but the primarily it's because there's curiosity, and there's
Okay,
been that
yeah.
lifelong sense of I'm different, there's something going on here that I can't quite explain.
Okay,
And so they're
yeah.
looking for those answers, they're looking for some explanations. And chances are, a lot of the adults that I talk to, they've either had people mention, hey, had an autism assessment because some of their quirks or their characteristics are typical, or they've done their own research and then they're looking for some answers after that.
Okay. And Lindy here, when people are seeking their ADOS assessment, do they typically go through the public channel, the hospital, or they just paid it private because a few $100s is a lot faster?
Hmm. Primarily private. There's
Okay.
um, quite a few practitioners because you do get trained in the ADOS. And it's not the
Okay.
only diagnostic tool out there. So there's other
Mm,
practitioners that might use other tools. The ADOS is just considered the quote unquote gold standard. And you
okay.
do a training. I did a training for it, and then so now I'm able to do the assessment with with people.
Mm. Yeah, I guess if they go through the public, how long is the wait time to do something similar for work purposes or other things?
That's a good question. I'm not sure. I
Okay,
can't
yeah,
speak to that.
okay.
Chances are if you're going through the healthcare system,
Yeah.
again, there's wait times. And then it's just a matter of finding someone who has that ADOS certification to move forward.
Okay.
The actual multidisciplinary formal diagnosis process can be lengthy. So you're looking at, a few weeks to a couple of months, depending on how long it takes to get all of that information gathered and analyzed.
Oh, I see.
But the
Okay,
ADOS
yeah.
is nice because it gives you that immediate diagnostic impression. It gives you some immediate answers. And then if
Okay.
the client chooses to continue with some additional therapy sessions, we'll use that information to look at
Yeah.
strategies and some psychoeducation and some different ways of approaching some of the what they've internalized that can help with their internal healing as well as their daily functioning.
So Lindy here, after you give the people the ADOS assessment, and how do the clients normally take that results and outcome?
It's different. Primarily, there's a sense of relief or aha, I knew it. There is that time needed to process. So I send the report before we meet, unless I give
Okay.
the client the choice, unless they would rather debrief it
Mm,
together
yeah.
initially, but I like to give them that time to process it, and then
Okay.
we do that debriefing appointment, so they have that time to ask questions, and if they're not satisfied with the report or they think there's some things that have been missed, then we'll go back to it and revise and update with additional information as we get it.
Okay, I see. Okay, yeah, because there's a lot to digest after reading so many information.
Hmm. Hmm. And I try and
Yeah.
make it as person-centered and as less
Okay.
jargony as possible.
Wait.
So I have that initial coded, standardized
Okay.
explanation of whatever screeners we've used and the ADOS. And then I have a client-centered piece at the end of the report. So what the results mean, some suggestions for moving forward, and then again, that opportunity to ask questions and to debrief with me is extremely important.
Okay, I see. So Lindy, for performing the ADOS assessment here, what qualification does it need for the clinicians overall?
The qualifications would be your professional background connects to mental health, so clinical counselor, psychologist, and then
Okay,
you
yeah.
apply to become an ADOS certified assessor, and then you take the
Okay.
workshop, and then then you're able to move forward with that assessment
Okay,
piece.
I see. Okay. So how is your collaboration with the psychologist work for the ADOS assessment and the reporting?
Well, that's if the client decides they want to move forward with the formal diagnosis. So oftentimes clients
Okay.
are content with the report that I gather all the
Mm,
information for and provide an analysis with. But sometimes
okay.
clients want that actual formal diagnosis where the
Okay.
psychologist makes that formal assessment or that formal diagnosis based on the diagnostic statistical manual. So the making sure that all the criteria is met, they take into account all of the information. I can debrief reports and I can write reports, but we need that psychologist who is classified as a person who can do assessment and
Mm,
diagnosis to make that final assessment.
I see. Okay. So, Linda, what are some of the individuals, what are the reasons or purposes they need to go beyond and get their actual diagnosis? For what purpose?
Sometimes for work, they need that
Okay.
for accommodations, for instance.
Okay. I see.
Schools, a school will often accept the ADOS and just, a clinical, the diagnostic impression. Sometimes they'll need the formal diagnosis. I have one
Okay.
client that needed a formal diagnosis in order for their dog to become a therapy dog, for instance.
Oh, I
So
see.
there's different
Okay.
reasons to move forward with that multidisciplinary diagnosis, and it is a bit more costly. It take because there is a lot more time and people involved, but having that final set in stone formal diagnosis is what some clients are looking for.
Oh, yeah, Lindy, you mentioned some really for occupational purposes. And then I guess for some people who are in university student, they just need the ADOS. That's enough. They don't need the full diagnosis.
Exactly. Yeah.
Oh, I see. So let's say, Lindy, a client see you, they get the ADOS, and then they said, oh, work needs a full diagnosis. What's the next step? Do you connect them with a psychologist or using the same report?
We use the report, and then I do a lot of the footwork. So whether
Okay.
it's interviews with parents, spouse, siblings, then
Okay.
because the adult is an adult, they can go get their own medical
Yeah,
information.
yeah.
Yeah, so we have a checklist that I work with a psychologist on, and then I do the footwork and coordinate with her for the final analysis. And then the
Oh,
final report, we can do a dual collaborative debrief, or they can meet directly with her.
oh, I see. Okay, yeah. So, Lindy, we talk a lot about the ADOS here. I understand you also provide education assessment and level B. Tell us more about what does it mean, education assessment and level B means.
Well, what that means is it's academic assessments and then just screeners like functional behavioral assessments. So within a school setting, that's where the majority of my experience is. And it
Mm,
might be parents aren't sure they know something's happening with their child. They're not able to get an assessment through the school right away. So you can come to me and we can do assessments on various areas like reading, comprehension, writing,
mm,
numeracy, social skills. We can do a behavioral analysis. We can get all of that data together. And what that does is it provides a really good foundation and understanding that a parent can take to the school to promote interventions that work for their child so that they are successful in the classroom.
Yeah, so let's say if the parents notice their children, their academic performance is not up to their average, or then they will seek that education assessment.
Mm-hmm. So a lot of times,
Okay.
in schools, you get benchmarking. So they might get like a Fontes and Pinnell or a numeracy benchmark, and their child might be evaluating at a grade level that's below. They might be noticing
Okay.
things with their schoolwork, like their reading comprehension, or they might be
Okay.
noticing things with their math. So what it does is because math, mental math to different kinds of computation, there's different pieces that a child might be succeeding at, and then some that they're struggling with. So what an academic assessment does is it actually attributes the strengths and where the challenges are. And then again, that allows for targeted interventions. So instead of saying, I'm bad at math or I have a problem with math, we look at, well, what exactly are the computational parts that a child is struggling with? And then those interventions and resources can be allocated to that student in order to promote their success.
Well, so let's say if for a parent, the children is struggling, they might not even know that they need an education assessment
That's true.
because they assume maybe the teacher will know and do something magical already.
It's
Oh, their
true.
parents know. They don't know. They don't know what they don't know.
Ask questions. Ask questions of the
Oh,
teacher. Do take that time to do some work with your child or your teen.
wow.
If they're asked, look at what their report cards are saying. Your biggest tool is having that connection with the teacher and asking lots of
Mm,
questions, looking at the work that your child is doing, and that gives you a
mm,
clue into where they might be struggling. Talking to your child, what's going well, what's not
okay.
going well, and being really specific with it. So parents will often say, you say to, how was your day? What did you do today? And the child says, nothing. So
Okay.
instead of saying, what did you do today? Say, how are you doing in math? What are you working on? And if they're talking
Okay.
about fractions, how are you doing with fractions? Do you know how to add fractions? Are you multiplying fractions yet? Let's look at some of your work and see how you're doing. Make it rather than um, uh, a discipline thing or
Oh, yeah.
consequences. Make it really as curious. I'm curious. I want to see what you're doing, and I really want to celebrate what you're doing well.
Okay. So ask a lot of open-ended questions for the parents.
Exactly.
So Lindy, how does it normally work? Let's say the parents talk to the teacher, and then how do the teacher refer the student to academic assessment with a professional like yourself?
Well, within each school division, they have a process with that. So they'll have a contact in the school, or it'll go through the principal,
Mm,
and then
yeah.
they'll let the parents know what the process is, the wait
Okay.
times, and
Yeah.
things like that. I think what's really great about having that option to do it privately is sometimes the teacher may not be seeing what you're seeing, or they may not they may have priority cases, those complex kiddos that really need an immediate assessment. So by coming to a private practitioner, and getting an
Mm.
assessment done, then the parents get that information right away.
Oh, I see. Okay. Yeah. So what type of training is required to perform this assessment?
Masters of Education is the what I
Mm.
have that allows me to
Oh, I
to do
see.
those assessments.
Okay. Yeah. So not all teachers can do it by default. They have to refer to a professional.
No, that's correct.
Okay. Yeah. So Lindy, let's say a parent approach a professional like yourself because the public system is too slow to do their education assessment. Uh, what is involved and how long is the appointment usually?
Well, we do an intake call again because I want to make sure that what
Okay.
what I'm offering, or when
Mm,
they do meet with me, that it's
yeah.
the most efficient and effective process for
Yeah.
them.
Yeah.
So I'll do an intake call, and then decide where we need to go from that. It
Oh,
might be
wow.
a lot of emails back and forth with different kinds of screeners and questionnaires in order to start
Mm,
developing the profile for the child before I actually meet with the child and do that
mm,
assessment. Unfortunately, with younger kids, it's very
mm,
difficult to do virtually. But if we're looking at older kids or even adults who are looking for some clarity or information around where
mm.
their strengths and their challenges are, I'm happy to do that as well.
Oh, especially nowadays, a lot of people are entering or re-entering education, changing career
Mm-hmm.
in 30s, 40s, 50s, 60s, 70s. So that will,
Absolutely.
yeah, there's a crucial service gap.
Yeah, and what's really great about that is once you know, then we're able to work
Yeah,
together to develop strategies, whether it's executive functioning strategies or study strategies,
yeah,
prioritizing, what tools are out there that you can use, assistive technology. There's just so many potential possibilities and opportunities for support. No one should have to feel like they have to struggle through it. And I
yeah.
think that's one of the exciting things about offering this.
And there's a big thing here, Lindy, because how often do we hear people, I want to go back to school to change my career, but I remember back then school is very difficult. And
Mm-hmm.
of course, they're working, they are not connected to a teacher to do this referral to an assessment here. They are really stuck.
It's true. And I would suggest for people who are listening or people who are wondering, have those questions, use a multiple intelligences test. So there's
Okay.
a really good one on the ALICE website. It's an Alberta careers website. And what it does is it helps you understand, how do I learn? So am I a visual learner? Am I an audio learner? Am I a kinesthetic learner? And that helps give clarity to maybe why you struggled in school. Because if you were in school and all you got was lecture style teaching and you aren't an audio learner and you need to
Oh,
interact with the material, then you're not going to do as well in a class that actually has you do hands-on project learning or hands-on learning that gets you really involved in the material that you need to learn.
okay. Wow. Yeah. So, Lindy, you do the assessment, start with the typical screening in suitable and screening out unsuitable assessment participant here. Let's say after you finish the assessment and they get the results, what did they do the next step?
For the academic results,
Oh yeah, yeah. Let's say a children or parent they get the results. What did they do next?
well, that depends. That would be on an individual basis. So it may
Okay.
be working with the parents on, how do I navigate the school system? It might be working with parents on what other ways can I get
Oh,
support. So, trying to connect them with tutoring or parent groups.
okay.
That's
Oh,
a really big thing, because you're not alone as a parent, and you're
okay.
not alone
Mhm.
as an adult who may be struggling with some of the academic pieces. So knowing that there's help there, I think, is one of the key pieces for um, making the assessment have a purpose. So I always talk about
Mm,
assessments. Why are we doing the assessment? So we don't do
mm,
them just for the sake of doing the assessment. There needs to be a purpose to it. So if the purpose is to get additional support or be able to know where we need to
okay.
target that support, then to me it's really ethical and it's relevant. If the purpose of the assessment doesn't we don't see a value in it, then I'll talk to the parents about that, because we want to make sure that we're not putting children, especially, through
Mm,
assessments that take a long time unless we can see some value in it.
okay, yeah. So it's value and purpose driven and ethical and professional. Okay.
Mm-hmm. Absolutely.
Wow. So Lindy here, let's go back a little bit about because a lot of viewers are very interested about neurodivergence in adult, the late discovery for different
Mhm.
ages in adults. What does it typically mean in a clinical setting when you see those clients?
What it means is mm, a lot of understanding around patterns.
Okay.
There's and a lot of understanding about identity, and a lot of understanding around
Yeah.
that feeling of fitting in and validation. So
Mm,
ultimately, that validation that, okay, there isn't something wrong with me. This is how I am.
yeah.
This is how my brain processes things. And then we work together primarily around those areas of acceptance, and
Mm,
how do I get to that point of healing and acceptance of how I am, because for so long, adults are struggling with trying to fit in, trying to feel normal. Why do I
yeah.
have these tendencies? And learning how to make good choices with that as well.
So Lindy, you talk about the personal internal level. Let's talk a little bit about because the acceptance is individual and also maybe their spouses, their girlfriend, boyfriends to accept because they might be look at the person in a different way in the past, interpret those
Absolutely.
behavior in a totally new way, families conflict previously.
Absolutely. And even things like,
Wow.
smoking, drinking,
Okay,
using recreational drugs, sometimes that's where the go-to is for in order to cope or in order to fit in. And there's still that sense of, there's something wrong with me. I'm not quite clicking with the world around me. And when you have that understanding of, this is why it does, all of a sudden it clicks. And some of those puzzle pieces that have been maybe rattling around in someone's internal consciousness comes to light, and then we see, oh, that's these are reasons why I'm making some of the choices that I'm making in my life
Yeah.
today, or the choices that I made in the past. And it really helps get some clarity. And ultimately, in the therapeutic process, it's about, so we can understand patterns, we can understand whys, but what is the impact and what does it mean for that person today? So it is what it is. What am I going to do about it is eventually where we get to. And that understanding and those clicks and those puzzle pieces are all part of that process.
Yeah. Oh, Lindy, a lot of viewers are interested about this term called masking. And we want to hear from you, a professional, because we hear about masking in social media, YouTube, TikTok. But what exactly is masking, Lindy?
Well, it's hiding. It's hiding. It literally is like putting a mask on that to pretend you're
Okay.
someone else.
Very well.
It's in some cases, like as someone with anxiety could really understand this. So in some cases, it might be being in social situations
Mm,
and inside just dying inside and thinking, how am I going to get through this?
mm,
And recognizing that it isn't that it's the social situation, it's understanding that how you're anticipating the social situation and how you're
yeah.
processing it has been hiding behind a mask. And once that mask is revealed, it's you can use that. It's not necessarily entirely negative, because you can use the strategies that you've developed through masking in order to integrate into work, or know the appropriate ways to respond, or have a friendship,
Mm,
or how do I talk to my spouse. Some of those things that you learn throughout the
yeah.
years in order to survive become tools when you move on to
Mm.
that recognition of, this is who I truly am.
So, Lindy, here, how about for, let's say, an outsiders, let's say a spouse, a partner, a parent, or best friend of somebody? How do the outsiders notice that, oh, this individual or my best friend is masking, to be aware of that, to inform the individual? What are some of the signs that people can pick up that individual is masking?
Well, you can see a disconnect between how the person is and how they're responding and
Mm,
how they're processing. For close relationships, you'll often hear the individual talking about fears, anxiety. I don't, and you might even find that they're making choices to avoid situations and not
mm,
really understand why that's happening. So once you understand why that's happening, you can work with them
mm,
on, like exit strategies. For instance, if you have to go to a Christmas party, or you have to have the family over, then what are my exit strategies? How can I help my spouse
mm,
cope with the noise that's going on? And then you
mm,
also start understanding those nonverbal cues in a different way, and you don't take it personally. I think that's a big plus
okay.
and a big win for relationships, is when you start understanding where some of
Mm.
these traits are coming from. It's not about a personality flaw, it's not a personality defect. And that gives a lot more compassion for the the um, the people that are around the client who's struggling with some of these things.
Yeah, so it's very interesting here. Let's say we look at avoidance of parties. So it can be under neurodivergence, which is since birth, or it can be under anxiety, which is developed in later. So we have to solve that puzzles.
Absolutely. And
Wow.
it can be both. You can have an anxiety disorder and
Okay.
have autism. You can have autism and you can have ADHD. You can have autism, you can have anxiety and depression. So when we look at these a concurrent diagnosis, they're the ones that are happening parallel to the autism diagnosis. When we're looking at the differential diagnosis, like trauma or anxiety as being the primary reason for some of these traits,
Mhm.
it
Yeah.
doesn't necessarily change the strategies, but it does change a little bit of the way that we approach some of the interventions or the
Mhm.
psychoeducation that happens in a session.
Oh yeah, yeah. The complexity just require more comprehensive assessment rather than very quick labeling about
Mhm.
This person is this, that person is this. Yeah, for the lay person and professional on a population. Yeah.
Yeah, I often ask is this a TikTok diagnosis or is this where did you get this diagnosis? Because there's so much out there, which is wonderful because it's opened up
Yeah.
this conversation around mental health and helped a lot with stigma. But on the flip side, the self-diagnosis or I'll often get calls even from friends saying, "Hey, I watched this video where I did this self-check. I think I have this." And I kind of have to just laugh with them and say,
Yeah.
well, maybe we want to explore it a little bit more from the clinical side. But it's got its silver lining, but also some things that we need to be careful with.
I see. Okay. So Linda, today, oh, there's so much more to talk about. We're close to the end here. We will have to invite you again here. Um,
Thank you.
for a closing message here, what are some of the key message you want to tell viewers, fellow clinicians, parents, or adults in for today in the closing here?
I just want to say that there is support. You're not alone. There's a multitude of, not only from when we look at the self-help and the resources that are out there, reach out for even an intake call and get some more information. There's always help available, and there's people that are going through the same challenges and situations as you, and it's just a matter of finding that connection and being on your own road towards healing and understanding.
Okay. Yeah. Thank you, Lindy. And if any of the viewers, public, fellow clinicians want to contact you, we'll also put it in the YouTube comments description here. What is the best way to contact you, Lindy?
Through the Wong Counseling and Associates website is the best place. You can
Okay.
book an appointment with me, and the best thing to do is to start with the 15-minute intake call so that moving forward we start on the right foot and in the right direction.
Okay, I see. Okay. And Lindy, we'll also put your phone number and email here so people can contact you directly too. Okay.
Wonderful. Yes. Yep. Either way
Yeah.
is great, and I'm here to support any way that I can.
So Lindy, we are so happy to have you. We'll have you back soon. Okay.
Thanks, Joseph. It's been a pleasure.